you are you are not question. We instruct you not to drink or eat at least 6 to 8 hours before surgery, so that you become dehydrated. The third one is that you're immobile during surgery. And right after surgery, there's also decrease in mobility, usually due to narcotics and to pain. What I do is to hopefully prevent this. We ask you to go to the hospital at least 2 hours prior to your scheduled surgery. We'll start an IV and give you at least we'll start an IV fluid and give you at least 1 liter of normal saline to hydrate you. We'll give you a blood thinner under your skin before the surgery, and which you will continue to do so after you go home for 10 days. I'll give you a prescription to get this medication. Thirdly, we're going to place a leg massager to pump the blood back to your heart and lungs while you're asleep. Last but not least, I want you to walk. Walking is the best question. Ambulation is the best deterrent from preventing blood clots. Pneumonia and atelectasis. Atelectasis is a fancy way of saying that you're not breathing deep enough and air gets trapped in your lungs, and that causes fever. It attacks your lungs and you develop pneumonia. Later complications include anastomotic stricture. That is where I hook up the small bowel to the stomach. I use a circular stapler, and occasionally 5 to 10% I use a circular stapler, and 5 to 10% of the time that hookup becomes tight. That's secondary to the scar formation. If that happens, you will be able to tolerate liquid but not solid or semi-solid food. If that happens, please come to the office. Please call. If that occurs, if you notice these changes, give us a call, and we will see you and send you to a gastroenterologist to have an upper endoscopy to dilate the hookup. Anemia, B12 deficiency, calcium deficiency, we have discussed that earlier. Anemia can be caused by iron deficiency. B12 deficiency also causes anemia. Same with calcium deficiency. To add, I would like you also to take vitamin D. Lactose insufficiency. There's a possibility, since the milk, because there's a possibility when you drink a large amount of, because there's a possibility that when you drink a large amount of milk, this will flood your small bowel and overwhelm your lactase, that you will not be able to digest the lactose very well. Hair loss. This occurs if you don't take enough protein and vitamins. It is very important that you take at least 60 to 80 grams of protein a day, or in some instances more than that, to maintain your normal protein levels. Like any other surgery, bleeding can occur. Splenectomy can occasionally happen. If for any reason you do not want to receive blood due to religion or other causes, please let me know so that I can make arrangement. Period. Ventral hernia is very rare with laparoscopic technique, since the incisions are very small. Internal hernia is a kind of hernia that occurs inside the abdominal cavity. A piece of small bowel can herniate through an opening, which which usually occurs where I hook up the small bowel together. So internal hernia usually happens after losing large amount of weight. If this occurs, if you develop an internal hernia, I can repair, because if you develop internal hernia, I can repair this laparoscopically on outpatient basis. Wound infection is rare with laparoscopic technique. Adhesions or scar tissue can occur, but it's also rare with laparoscopic technique. There are some instances where the tissues reject this elastic ring, which I have to remove. The leak rate is high with gastric bypass. Takes me about an hour and a half to 2 hours to perform a gastric bypass, and 45 minutes to an hour with the banding. There's cutting and stapling in bypass, there's none in banding. There's dumping syndrome with bypass, none with banding. There's rapid weight loss with bypass and very slow with banding. There's less vomiting with bypass. There is limited intake of carbs and fat in bypass due to dumping syndrome. There is no dumping syndrome in banding, so the patient can eat any kind. I can eat the fat, so the patient, there's no dumping syndrome with banding. There is built-in help with behavioral modification because of ghrelin and bypass, and there's no ghrelin changes with banding. One-time surgery fee on gastric bypass. There are multiple fees with banding during the adjustments. Leak rate is higher with bypass and lower than in sleeve. Again, the longer surgery time for bypass, shorter with sleeve. They both require cutting. They both stay in the hospital for 24 to 48 hours. There's dumping syndrome with bypass. There is dumping syndrome with bypass. There's none in gastric sleeve. There's a higher risk of vomiting with gastric bypass. There's limited intake of carbs and fat with bypass, none with the sleeve. They both have built-in help with behavioral modification. Both have one-time surgery fee. Gastric bypass is reversible. Gastric sleeve is not reversible. What can you expect after bariatric surgeries? You have to follow a strict diet. I recommend the same diet for I recommend the same diet for all three surgeries. This is composed of high protein, low fat, and low carbs. Since the incisions are almost identical, so the pain is also almost identical. The length of time that patients return to normal activities depends on the length of time for the patient to return to normal activities will depend from patient to patient. Some patients have good tolerance for pain, others don't. I will discuss with you, because your return to work will depend on what nature of work do you have. Lifestyle changes necessary to ensure success. My age limit is from 18 years old to 64 years old. Everybody will undergo a thorough workup. Your workup will depend on your comorbidities. The amount of weight loss is variable We will discuss that during your visit. The lifestyle changes has to happen. You have to exercise and become active to maintain a good weight loss. Change your eating behaviors is very important. Which surgery is good for you. We will discuss that during your initial consultation. I want to individualize the surgery. Not everybody will respond the same way to each surgery. We'll discuss with your family and friends. It is important that you have a good support system with your family or friends. Dumping syndrome is found only in gastric bypass. It's a good thing because it prevents you from overeating sugars and fats. With gastric bypass and adjustable banding, it's very important. It is very important because with gastric bypass and adjustable banding, it is very important that you slow down on your eating. If you eat too fast or don't chew your food very well, there's a big chance that the food will get stuck in your stomach and you'll have to vomit and become very uncomfortable. Do not overeat. It is important that you set your amount, what you're going to eat, and stick to it. Do not go for seconds. Use a small saucer so that psychologically it will help you eat a smaller amount of food. Don't eat mindlessly. Most of the problems of vomiting while eating occurs in a social setting. Vitamins are required for the rest of your life. There is an internet tool that you can log in once you have the surgery done. This is sponsored by Ethicon, a subsidiary of Johnson & Johnson. What are your next steps? If you're serious and committed to have the surgery done, please read and learn more about the surgery. Please read the packet that we've sent you. It's very important that you read this before you see me in the office the first time so that you can get the full benefit of that visit. There's an independent financing company. We will give you the information on your first visit. My staff is here to help you. Occasionally there's a delay on the response of the insurance company to our requests. Please be patient. In conclusion, bariatric surgery is effective in controlling morbid obesity with behavior modification. And the benefits of bariatric surgery by an experienced, competent surgeon exceed morbidity of surgery. I hope you enjoyed this video. If you wish to make an appointment, please call 918-252-2800